Hello everyone, welcome to QXon. Let us discuss some important cases of central nervous system, namely bitemporal hemianopia, cerebellar tumors, Parkinson's disease, stroke and syringomyelia. First case, a 26-year-old man presents to the ophthalmology OPD with complaints of inability to see on either sides, that is right and left of the road while driving. On examination, his vitals were stable, hands and feet were enlarged. Protrusion of the lower jaw was also noted. And then test to rule out glaucoma was done. MRI was done which showed a mass in the anterior pituitary. So what is the most likely cause of this visual defect? What are the other causes which can cause similar visual defect? Then any other visual defects we know of? Then what are the optical and retinal factors affecting visual acuity, and add a note on physiological blind spot. This is a case of bitemporal heteronymous hemianopia. You see, one side of the visual field of both the sides, right and left, is affected, right, and that too on the temporal sides are affected. So definitely the name is bitemporal and heteronymous because different visual fields are affected, and hemianopia because the half portion of the visual field is affected. Then what is the cause of this? Well, we saw that this feature was associated with the features of excess growth hormone. We saw the features of acromegaly in this case. So the most likely cause is a pituitary tumor because there was also a mass in the anterior pituitary as was shown by MRI. So pituitary tumor adenoma might be there. But there may be other causes which can lead to such visual field defects like pressure on the optic chiasma, craniopharyngioma, anterior communicating artery aneurysm over optic chiasma. So in this case, maybe pituitary tumor which is secreting excess growth hormone is pressing over the optic chiasma and thus affecting the nasal fibers, and nasal fibers carry the information from the temporal field of vision. So that's why we are getting bitemporal heteronymous hemianopia. Then what are other visual field defects? Well, depending on where in the visual pathway lesion is there, we get different visual field defects. For example, if there is a lesion on right side temporal fibers, then temporal fibers are basically carrying the information from the nasal side of the visual field. So we will get right nasal hemianopia. If we move further, if there is lesion of left optic tract, now left optic tract is carrying the nasal fibers which have crossed from the opposite side and the temporal fibers of the same side. So if we project it to the visual field that from where these fibers are carrying the information, what we will get is right homonymous hemianopia. So lesion of left optic tract will cause right homonymous hemianopia. Similarly, lesion of geniculocalcarine tract, that also similar to what we saw in optic tract, it carries ipsilateral temporal and contralateral nasal fibers, so they will be damaged, and then again we will get homonymous hemianopia of the opposite side, but there will be macular sparing. Now our next question is that what are the factors which affect visual acuity? Well, there are optical factors and retinal factors. Optical factors are the one which will affect the pathway through which light is travelling. So curvature of lens and cornea affect visual acuity, plasticity of lens, then condition of ciliary muscles and lens ligaments also affects visual acuity. Retinal factors include the activity of the cones, and that is why we have highest visual acuity at fovea, where we get highest number of cones. The density of cones is very high at fovea. Our final question was on blind spot. Well, blind spot is mapped on perimetry and it is located on the temporal visual field. Basically, it is an area in the visual field where we do not capture any light sensation from that area of the visual field, and this happens because there is a part of retina which lacks any photoreceptors, which does not has any photoreceptors, and that is the area from where the nerve, optic nerve, is leaving the retina. So because of the absence of photoreceptors, there is presence of a blind spot in the visual field.